Right, good morning, members. Good morning, members of the public viewing our meeting of the Health and Care Social Care Committee. Could I start by my name's Gareth Jones. I'm the Vice Chair of the committee, and I'm standing in for the first hour while our chair is on her way back from an appointment that she had yesterday, stuck in traffic at the moment. Could I welcome those who are new to the committee to their first committee meeting? Can we start with O'Connor with any apologies?
We've got apologies, Chair, from Councillor Liz Rinnenberg, who's on other council business, from Councillor Chris Walsh, and also from Officer Lynette Lovell, Director of Education and Children.
Thank you. Does any member have a declaration of interest?
I think, Chair, I have to give it regarding CHC, Llais.
Thank you, Edwin. Right,
and I believe there will be another one as well, Chair, from Councillor Helwyn Hume when she joins.
Thank you. Thank you. Can we go on to item 3? Is there any disclosures of party whips? No, thank you. Item 4, the relationship between Llais and Powys County Council. I'd like to welcome Katie Blackburn, the Regional Director for Llais, to our meeting. Good morning, Katie.
Good morning, Chair.
And I'll hand over to you. How would you like questions at the end or as we progress?
Well, I think because I'm going to share my screen, I'm hoping that you've all had a copy of the slides in advance, because I think it's really important that I sort of provide a summary, but there's time at the end for questions. So if that's all right in discussion, Chair, I think I prefer to take it that way because I won't be able to see the hands up anyway.
Yeah,
is that okay?
Could
I just clarify with you, Chair, the time slot I've got for this session? I think it's 45 minutes, but I just want to be clear. Win, sorry.
I'm waiting for Win to nod or shake his head.
Sorry, I think I suggested initially sort of 30 minutes, including presentation and questions, but you know, I can't see I've had your slides, Katie, from memory. So apologies if I haven't had it, but I'll sort that out. I'll sort that out. I'll look for it now and circulate them while we're doing this.
What I thought I'd do is to sort of zip through them and just pick up the salient points. And I'm more than happy to come back or to meet any of you individually if you think that that would be helpful going forward. So if you'll forgive me, I've had a bit of an IT stressful morning, so I'm just going to hopefully share my screen now.
Thank you.
Can everybody see that?
Yeah,
I can. Sorry, so yes.
Yeah, did.
Right, let me just put something there now. Sorry. Still there?
Yep.
Yes. Yeah.
I'm sorry, I'm not very familiar with Zoom these days, but so I'll just zip through it if that's all right. So firstly, my name's Katie Blackburn. I'm the Regional Director of Llais, covering the whole of Powys. I also have a corporate lead for volunteers across the whole of Wales. So I'll come on to that a little bit later on and about how we will continue to be in expanding our work with volunteers. So just a little bit of background. I know some of you are or have been familiar with the Community Health Council in the past, but I just thought it would be useful just to sort of provide you with a little bit of an update about the CHCs. The CHCs were around, the Community Health Councils were around for about 50 years, and they provided 4 key functions really. They have, or they had an independent advocacy service. They visited premises, hospitals, doctor's surgeries, spoke to patients, listened to patients. We had a scrutiny role, which was very much focused on making sure that the communities and individual voices were heard, if there were any changes that were going on, if there were any developments that were going on. And obviously we had an engagement role, so that could be the local shows, it could be working with Future Fit. But the key with the community health councils, and one of the key differences, it only related to health services. So we had a very strong, we'll continue to have a strong relationship with the Health Board. I sit on their board as an observer and attend a number of other meetings, and we meet with them on a fortnightly basis just to make sure that we're all up to speed about the developments that are going on within the health service. So the challenge really, and part of the reason for presenting today really, is to look at how we can develop a similar relationship with the local authority and with yourselves as council and scrutiny committee. So Llais became law, well, the Health and Social Care Equality Engagement Act became law on the 1st of June 2020, and the Act came into force itself this year on the 1st of April 2023. And some of you may be familiar, it didn't just include the Citizens' Voice body, which is now known as Llais, it also included the duty of candour and the duty of quality. So it was a significant piece of legislation which impacts and should impact positively on the experiences of patients and individuals accessing health and social care services across the whole of Wales. So Llais is a statutory body. It's an assembly-sponsored public body. It's independent. The CHC, as some of you may know, was previously hosted by Powys Teaching Health Board, and there were always concerns, I suppose, although there was blue water between the Health Board and the CHCs, the fact that it was hosted by a health board always meant that there was a potential question over our independence. In reality, there wasn't, but the perception could have been otherwise. So this is an independent new body. The focus is on local, regional and national. One of the key differences, as I've mentioned before, is that it is about health and social care. It's not just the NHS. And I think the other important area that's different this time with Llais is that it also includes young people and advocacy for their experiences through the health service, not through the social care system, not through the local authority, because we'll come on to that a bit later on, but you obviously have your own complaints and advocacy service that you use as a local authority. So the board were appointed through public appointments. I'm very sorry, there's something over my sort of share the slide, so I'm just doing it this way, which I hope is okay. The board were appointed through the public appointments. Medwyn Hughes is the chair. Medwyn is currently the Vice Chancellor of Lampeter St David's, although he's retiring this year. Alison Thomas, actually Alison is the substantive Chief Executive Officer. Some of you may have come across Alison before. She was the previous Chief Executive of the Community Health Councils in Wales. And actually it's been, hugely beneficial to have that continuity and that knowledge following through into Llais. Each of the board members will be a nominated ambassador for each of the 7 regions of Llais, and in Powys we have Grace Quantock, who is the deputy chair. So I think just very quickly, we've got about 100 staff working across all the regions. The regions are split on an RPB basis, which has been quite interesting because local is the RPB, local is the local authority, regional is the RPB, and national is obviously national. And of course in Powys, the local and the regional share the same footprint. So the local authority is Powys and the RPB is Powys. So as an organisation in Powys, we've done quite a lot of work, and I've met with Nina and Lynette and Wyn and colleagues from the Health Board as well to actually look at splitting Powys into the 11 localities that mirror the RPB footprint, and they will be based on those 11 localities. So that's what we're looking at, and I hope that that will not create yet another boundary or different way of working. It also fits in pretty well with the community connector structure as well. So the whole focus will be on having local volunteers within those 11 localities who will be the voice for those localities. In the past, we've had differing membership categories. So we've had Welsh Government appointments, we've had local authority appointments, we've had third sector appointments, and then we've had co-opted members. But with Llais going forward, there will be no nominated volunteer. Everybody will be a volunteer in their own right. So if any of you or know of anybody who would like to volunteer with us, then please do get in touch. I think I've sort of touched on that. That's the sort of organisational, operational structure. If anybody's got a question when the slides go out, then please feel free to let me know. So the volunteers are going to be key, as they were with the Community Health Council. There will be 5 roles. There will be a visiting role. There will be an engagement role. There will be a virtual visiting role, which is particularly pertinent to Powys, as a number of the services that we access through health and social care are cross-boundary or cross-border. There will be an online feedback role, so that somebody will be monitoring the comments and things that come through from various community groups from an online perspective. So the whole point of the volunteers, which will be different to the CHC movement, is we want to be able to be really inclusive. We want to attract younger people. We want to attract a more diverse community. The commitment is likely to be less. We want to be flexible. So if somebody can't volunteer over the summer holidays or only wants to volunteer over the summer holidays, then we need to be flexible to respond to that. One of the things that we've done recently, and we've done it in conjunction with Nina and Lynette, is that we've worked in Welshpool. We've picked a geographic region. So we've had some very positive meetings with students and tutors from Welshpool High School. So, you know, they're very keen to have a sort of peer mentor and a link there. So it's about being inclusive and flexible in our approach. I'm not going to go through these slides, but if anybody, as I say, wants to pick up on them, they're quite wordy. So really, with regard to the focus for Llais, it's about engagement, it's about working with the community, it's about listening to community, it's about feeding back in representations. So through that engagement work, and that could be, as I say, it could be visits, it could be visits to care homes, it could be visits to hospitals, it could be visits to GP surgeries. The Llais will pull together representations that it's heard, and that's where we will share the representations with both the health board and yourselves as a local authority. And I think one of the discussions that is ongoing, and you know, I'd welcome people's thoughts and views on this, is how we feed that in through your structures as a local authority. With the health board, I attend the board meeting as an observer, I produce a report, it's in the public domain, and I feed back my representations there. But I think that's one of the issues that I think would be quite useful to not necessarily to bottom out today, but certainly to give some thought to about how that works within the local authority. And then, of course, we have also got our complaints process, our advocacy service, and that's not about actually making the complaint on behalf, it's about supporting the individual to make the complaint. And at the moment, we meet with the health board every week, and the plan is that we will do the complaints team every week, and the plan is that we hope to be able to do that, and those discussions have already started with the local authority, in order that we can actually hopefully resolve any complaints and issues from the outset before they sort of progress further through both complaints processes and ultimately up to the Ombudsman. So really it's very much about there's quite a duty on both the local authority and social services teams and on the health board to make sure that they promote our activities, to make sure that they listen and consider our representations in whatever they decide to do, and that we will feed back the things that we hear from the communities of Powys. So it requires a really strong working relationship, and we're establishing that, and it's been really positive over the last couple of months to really develop and strengthen the relationship with Nina and her team. We gave a presentation to her team last week, and similarly with Lynette and Lynn. And we're also working closely with the commissioning team, because the other difference I think it's important to note between Llais and the Community Health Council is that this legislation applies to services that you as a local authority commission in health and social care. So that might be from the third sector, that might be care providers, but this legislation impacts on them as well. And so it's working through how we take that forward. I think I've really touched on this. It is about being accessible. It is about being inclusive. We're very keen at the moment. We're at consultation on what our strategy and priorities should be. And although that seems perhaps, we should know those, and of course we do have a very strong view of those, it's about making sure that they are representative and reflective of what actually community members and individuals feel should be our strategic objectives. I'll send Win the link, but there is a meeting on Monday evening between 6 and 7:30, and I think a number of councillors have already expressed an interest. You should all have had the invitation to discuss what you think should be the strategic priorities for Llais in Powys and nationally going forward. So it's very much about working collaboration. It's very much, working with the third sector. It's not about duplication. It's about how we can work together, how we can work with the community connectors, how we can work with your teams, and how we can actually make sure that that is a strong seamless support for individuals and communities across Powys. As we found in the past, when it was the CHC, somebody who was in hospital, we could support them, but as soon as they were transferred perhaps back into the community, a care package or not, as the case may be, then we weren't able to continue to support them. So hopefully this new organisation, one of the main aims will be to make sure that it is a seamless support for that individual and for those community members. So one of the challenges we all know are the cross-border and cross-boundary commissioning, and I've touched on that actually all services that are commissioned that relate to social care will also be impacted by this legislation. I've touched on local, regional, national. We're really keen to make sure that, and it's a real opportunity, that the structure we put in place for Powys is actually pertinent and relevant to Powys. And recognising that we all know the size of it, we all know the demographics of it, we all know the challenges, we know the different environment challenges. So it's just about making sure that whatever we deliver fits and suits that local community. The team, we have an office in Newtown and we have an office in Brecon. I have 7 staff, so it's quite a small team to deliver a huge agenda, but actually that's one of the rationales for also making sure that we recruit, support, train new volunteers from a wide range of backgrounds. I've touched on priorities, so I hope that it makes sense. And then I think the other thing really to make sure that you're aware of, and again, I can send these to Win, is that recently Welsh Government have signed off the statutory guidance for representations and statutory guidance for service change. And both of those documents will be pertinent to you as an organisation, less so service change, but certainly the representations. And then last week, the access to premises, the code of practice for the access to premises was published. And those were all 3 documents we're picking up with the officers of the local authority to understand the impact and how we can take that forward. So I think, Chair, just in summary, I suppose it's about being really clear that we want to listen, and we will be listening, and we want to build on a lot of the good work that has been going on. We want to make sure that we are inclusive. We want to make sure that we are grassroots. We want to make sure actually that people are able to come to us, and that we will actually make an impact by making those representations, and that the voices of the communities of Powys will influence change and the provision of services across the area. So as I say, I've touched on the fact that I attend the Powys Teaching Health Board, and again, that's something we need to sort of unpack. How does that fit with Cabinet, with Scrutiny, and with your your officers groups? I met with your Chief Exec a couple of weeks ago and had a really positive conversation with him. So it's how all of that sort of fits together, and that's new for all of us, and we might not get it right first time, but it's we've got some really positive relationships that are already being developing. And just to reiterate that there's an opportunity on Monday, and I'll send, as I say, Win the details to feed into the sort of strategic direction and priorities. So diolch yn fawr iawn. I think that's it really from me, if that's okay. And I'm quite happy, Chair, to take any questions. As I say, there's a lot to take in there, so I appreciate that, but I'm very happy to come back at another point, or I'm very happy to meet with groups or individuals separately. Diolch yn fawr.
Thank you, Katie. Any question from members? Please raise your hands in a normal way. Perhaps I could start, Katie. You mentioned about the cross-border. I live in Radnorshire, and obviously our DGH is in Hereford. There's lots of concerns that I'm told about, that we're treated as second-class citizens or even third-class citizens as residents of Powys in Hereford. What powers, if any, have you got to try and influence that?
It's really interesting that comment, because we do pick that up. What we do is that we raise it with the Health Board, and we seek that assurance from the Health Board. We raise it with the Wales Ambulance Trust. There isn't any evidence to suggest that that is the case, but we undoubtedly know that there is a feeling that that is the case, and so there's something there about communicating and making sure that that community is given that reassurance. To be quite honest, the access to Hereford at the moment is one of the better routes to some of the other hospitals that are around our borders. So I think, again, it is about communication, but it's also about, if people have got concerns or issues, then please do let us know. We're not psychic, and this is the whole point of being able to have teams on the ground that can feed those concerns and issues into us, and we will follow them up, and we will make those representations to the Health Board. As I say, we meet with them on a fortnightly basis. We attend their board meetings. We attend their patient experience committee, we attend their planning committee, we attend their audit and risk committee. So there are lots of opportunities, Chair, to feed those sort of concerns in, and to make sure that that assurance is provided.
Thank you. Can I just ask a link question that you said about letting you know? I know the CHC uses, I'm clerk to our local community council for my sins. The CHC used to send out notifications when they're having their meetings, etc. Is that something you tend to replicate?
Yeah, no, it's happening. We haven't changed our stakeholder list at all. We've expanded it. So all the town and community councils, all of you individually will be on that stakeholder list. So everybody should still be getting everything that we're sending out.
Right, and finally from me, what powers of enforcement, or what powers of enforcing any actions for either the health or county council do you have?
Well, I mean, hopefully, when we were with the Community Health Council, we had the right to refer to the minister. I never, in my role, I've been here 5 years, I've never referred to the minister, because actually, to be quite honest, I see that personally as a failing, and that actually, if there are challenges and there are issues, then we need to, really do everything we can to work together to avoid getting into that situation. With regard to Llais, we still have the right to communicate our concerns to the minister, and of course, ultimately, there's the whole concept of a judicial review. But But I would really hope that we wouldn't get to that stage. And that's why we are strengthening and working our relationships with your officials and also, you know, individual members of the local authority. Yeah, so I mean, all of us want what's best for the communities of Powys. So actually, you know, hopefully we can work our way through that.
Does anybody else have any questions? Yes, Sandra.
Thank you, Chair. Thank you very much for the presentation. Very comprehensive. I know it's a whistle stop tour, but I think it gives us the flavour of what's to come, which sounds very exciting. My concern, and it's always been, with accessing or communicating with people who are hard to reach for whatever reason, whether they have a disability or whether they're living on their own, and if they haven't got computer access, etc. What are the plans for improving that? Because it's always been a hard nut to crack. Thank you.
It's interesting, Sandra, because historically with the community health councils, when we were doing our engagement, we tended to engage with a particular group. So we tend to speak to everybody in Powys about their access to GP services, for example. And then we would produce a report, we would ask for comments from the health board, and we would publish it. What we've done in Powys in the last 2 months, which is slightly different, and it's a bit of a pilot, but we focused on a geographical area. So we've focused on Welshpool in this instance. There's no particular reason, but Welshpool has got a number of sort of interesting new developments that are going on there. And what we've done, we've focused on the wider community. So we've met with the carers, young carers, older carers. We've sat while there has been an over 60 swimming lesson going on in the leisure centre, and we've sat in the canteen. We've worked with a school, as I've just mentioned. There's a whole host of organisations which we haven't worked with in the past that we've actually listened to and worked with during this pilot. It's been quite challenging, partly because of resource, but actually I saw the initial report yesterday, and it's been really interesting to listen to some of the things that are coming out. We wanted to do some work, for example, with the Gypsy Traveller community in Welshpool. That's a community we've always wanted to work with. We haven't managed to do it in this pilot, but again, talking to Nina and her team, that's perhaps something we could do jointly together to access those communities. So we already have very established relationships with specific groups. So, you know, sort of Dementia Powys, we sit and attend their meetings. So there are already specific groups. My background, you know, I've been the director of drug and alcohol charity, domestic violence charity, Princess Trust. So my background is very much, my passion really is around those very vulnerable communities. And you know, it's interesting how you describe vulnerability. We did some work last year as a CHC about loneliness and isolation, particularly within the farming community. So, you know, in Powys, there's a range of different communities that we need to reach out to, but that's where the networks and the sort of 11 localities and you as councillors, you know, we can all support this together. Everybody's trying to do it, but actually if we work together on doing it, it might be more beneficial in doing it. So yeah, absolutely committed to working and supporting and listening and influencing those groups.
Thank you very much. Diolch yn fawr.
Thank you. Any other comments, questions from members? Yes, Councillor Ben.
Hi, yeah, thank you for the presentation. It was very informative. You said you've currently got a team of 7. So how is that going with like achieving your workload? And how many volunteers are you looking for, and any difficulties finding them? Thank you.
You look somewhere nice, Ben.
Justin Kerry.
Yeah, we've got a team of 7. They're a great team. It's quality, not quantity. But yeah, we've got a team of 7. The volunteers we're looking at, so if we split Powys into 11, we would probably be looking ultimately at trying to get 5 to 8 volunteers in each of the 11 patches, really. Some of our previous members have come forward, so that's great. And we've got a number of people that have expressed an interest. So please, if you know people who'd like to volunteer, as I say, in the past, we've sort of said you've got to do 5 hours a month and you've got to sign this contract and you've got to do this and you've got to do that. But actually the whole thing about FLICE is about it being far more inclusive and flexible. So, you know, if somebody, you know, is able to do, you know, an hour looking at Facebook pages on a Wednesday night, that's great. That's fab. That would be amazing. So, you know, please spread the word. And you know, what we're trying to do as well is to, although, I mean, again, it's really difficult. We know this in Powys, the boundaries, you know, you don't have a sort of brick wall around Brecon and nobody goes to Crickhowell or whatever. So, you know, it's about having flexibility, but just making sure that we've got people who are actually on the ground listening and who can feed that in through our processes.
Councillor Josie.
Thank you very much.
Yes, thank you, Katie, for that. It's very interesting, possibly thinking about joining myself actually there. Thanks. My quick question would be, would it be possible to have some publication sent from yourself so that we can put some information on our social media or tell residents that are interested in that as well, just so we can help feedback to see if there are some members out there that want to help and join you. Something that we can get on Facebook nice and quick with some links or a QR code would be really helpful, I think, because I'm sure that I've got multiple residents that would most definitely be interested in following this.
Yeah, absolutely. I mean, we've got QR codes, although, you know, we've had quite a lot of feedback from some of the communities in Powys about QR codes not actually necessarily always being the most accessible way. So what we're trying to do in Powys is to look at the different things. So we've got posters, we've got leaflets. The other thing that we found was really helpful when we're the CHC, and we've got them now, and I'm happy to sort of give you all a few. We haven't got hundreds and thousands of them, but we produce very generic business cards. I know business cards are a bit sort of, you know, old fashioned, but actually it's got the advocacy number on it, it's got the Brecon office number on it, and it's got the Newtown office number on it, and it's got the email addresses. So actually it's just quite handy just to hand out, rather than with GDPR and everything at the moment, we've got to be so careful about people sort of, you know, sharing information, and it's sometimes just easier to give individuals something that they can make direct contact. So yes, Josie, I'll make sure. Shall I do that through you, Wynne? Sorry, I'm not quite sure how best to do this. Sorry, forgive me. It's a new way of working.
Yes, by all means, please send it to me and I can circulate it to all members.
Okay.
Thank you very much. Thank you, Katie. Thanks, Wynne.
Yeah, I've already made a note that we should circulate your slides to all members of the County Council. So, yes, Nina.
Thank you, Chair. Just wanted to say thank you to Katie for coming along this morning. I mean, this is a new area of work for all of us, isn't it? And there's lots to learn. And I think the interaction between all of our existing processes and governance arrangements, you know, particularly yourselves as a scrutiny committee, is going to be really key moving forward. But I'm really excited about the opportunities here and the potential that there is as well, you know, in terms of strengthening engagement, co-production and all of that. So, you know, really kind of welcome the approach. And just to say that, you know, Katie and I have been working together now for quite a number of months in advance of the April implementation date as well. And we're continuing to meet fortnightly, and the teams are building really strong links as well. So just wanted to give you assurance as a committee that, you know, as officers, we're really committed to working with Katie and her team. I'm really quite optimistic and looking forward to the benefits, I think, and the potential that will come from it as well. And perhaps, Chair, Katie, being invited to a full council member briefing in due course might be a really good way to further spread the message of the work. I don't know, but just wanted to put it forward as a suggestion. Thank you.
Nina, can you see my screen? Because I was, as you were saying that, I was actually typing that same sentence about the member development session.
Oh, no, but great minds think alike. Thank you, Chair.
Indeed, thank you. If there's no further questions, can I thank you very much, Katie, for that very interesting presentation. And I'm sure we'll be in touch with you and be in contact with you over future times. Would you be happy if a member of your team attended a community council meeting if they wished you to attend?
Yeah, of course. I mean, we're happy. We need to, spread the word, work together. The community councils, I think, are really key in all of this because they're, they're so locally based. So yeah, of course we are. Please just get in touch. Before I leave, what I'll do, I'll just pop my email address in the chat bar, if that's all right. And then please feel free for any of you to contact me directly if that would be more appropriate.
Yeah, and thank you. And you stuck to your time very well. Right, thank you for that. Can we move on to item 5, which is the compliments, comments and complaints paper on social services? And I think, Steve, you're leading on that, are you?
Thank you, Chair. Yes, I am. May I share my screen?
Yep. Steve, will you be covering the recommendations we made last year?
Yes, I will.
Okay, thank you.
Right. Good morning, everyone. I'm Steve Holcroft. I'm the Policy and Customer Care Manager for Adult Services and Children's Services, and I oversee the Social Services Feedback Team. As I've explained every year, it's a statutory requirement that we have a social services complaints procedure in place. And also it's a statutory requirement to compile this annual report of our activities for the year. And this one covers obviously from the 1st of April 22 to the 31st of March this year. Just to put it in a little bit of perspective, and I'm sorry, some of these graphics have not transferred as smoothly as I would have liked, but up here we have the head of adult services, we have myself, and we have a complaints officer and an administrator. So we're a very, very small team, and our approach is based on getting it right first time, and if we can't, then putting it right as soon as possible. I won't go into all the details of the complaint handling system, but I would, or process, but I'll gladly take any questions on that. Fundamentally, one of our chief aims is to resolve complaints at the very earliest opportunity, and teams are encouraged to be proactive in achieving this goal as well. We've put the format a little bit differently this year, so we're going to start with comments that we've received. And if you look over the years, all of a sudden we seem to have a lot of an awful lot of comments in this period. And this was mainly due to a number of complaints that we had about a service provider, a commissioned service provider. So we recorded them as comments while we ourselves, the commissioning service and the provider, resolved the situations for the client. So that's why you'll see a very large increase. And I've just made a note there that we recorded these as comments while awaiting resolutions by service providers. Obviously, I won't go into all the details. But we've left some comment examples in there. What's the sort of comments that we deal with on a daily basis? And just for the flavor, as I said, regarding that service provider problem we had, I've left a few of those comments in there for us as well to go through. And you'll see a lot of them were financial reasons that the service provider were not providing the correct services to our clients. So as I say, I won't go through all of them, but we've left many of them on there to give you a nice overview of what we deal with. In terms of our compliments, these have remained fairly static over the period, a bit of a reduction in compliments, but I think a lot of those, perhaps we haven't seen as many compliments as we would have liked due to the pressure on services post-pandemic as well. That is something that is a reality that we've been working with as well. Again, I've put some examples in for you. And I just, this was one of my favorite compliments, and I just wanted to leave it. You can read it in your own time. But suffice to say, this individual has been recognized for her excellent achievements with children's services. A really lovely compliment. And as you can see, We have a host of good complements, up from life story books for children right through to the support they provide families and so on. And this is a really important piece of our work, because we really like to share with teams these examples of good performance, in the hope that this encourages more excellent performance from other practitioners as well. And I've just left in some complement examples for adults as well. Sorry, I just need to take a sip of and this was a lovely compliment we received regarding a safeguarding matter, the very first one, for example. And suffice to say, this came from our police colleagues, and it really does show. I hope that we're working very, very well with our partners in POIS. And I've left in a number of compliments for you to get a feel of what people express to us. Thank you. I'll just go on to the next section. I won't go through all of these. And then we get to perhaps the business end, which is the analysis of complaints. Now, it's important to state here that we see a relative, we've seen a reduction in the number of complaints received over the years. We had a total for this period of 212 official complaints, and it was down 1 from 213 last year. But over the years, from 17-18, where we had a total of 277 complaints, for example, for the period, we've seen a reduction right down to, as I say, 212 for this period. So hopefully, we are getting it right on a lot more occasions than getting it wrong. And I think that's an important thing to recognize. And what we always like to stress is that if there's an increase or a decrease in complaints, it doesn't necessarily reflect a change in the standard we're providing. It may just be that people are more knowledgeable about how to put in complaints and the number of methods we have for raising a complaint. I think an important point, particularly with children's complaints, is that they continue to be a lot more complex and involve a number of service areas and themes, and consequently often take longer to investigate and resolve. I'll just start here with looking at adults show an increased number of inquiries over children's, and this is in part due to a number of inquiries regarding a service provider failing to meet client needs, as I explained a little bit earlier. If we break down our complaints by type, and again, an apology for that graphic, not as clear as I'd like it to be, but we're not dealing with a huge amount of stage 2s. Most of our complaints are handled at the stage 1, or at the to stress at the informal stage. That's something we're still striving to achieve, is to try and resolve as many complaints as close as possible to it being made, without the need for long investigations and so on. It's important when you look at these complaints that not every complaint that we record might have been at stage 1 before it was in stage 2, and similarly not all stage 1 complaints would have been dealt with as an inquiry initially, because complainants have the ability to say from the onset how they would like, to some degree, how they would like the matter to be investigated. What we started recording now as well is the number of elements in our complaints, because of the complexity, so that we can pick up trends and themes of complaints to help us with our service improvement efforts. So we started to capture sorry, I was going to say, can you explain what you mean by an element? I'm coming to it now,
okay,
Chair. Yeah. What we do, we try and group our complaints into these elements, and I've just given an overview of what those categories are: the standard of work done, communication, quality of service, a provider complaint. And this just helps us to really sort out our data and get it into, as I say, so that we can pick up on those themes and act on them as well. Complaint outcomes. for every complaint, an outcome is given as upheld, partially upheld, or not upheld. And so you'll see it's a bit of a mixed field, but we do have many instances where we partially uphold complaints, particularly in children's, not as much in adults. And you could see they're not upheld is higher in children's there and lower in adults. For 23-24 outcomes for each element will be recorded on the new system. As I explained, I think last year we have a new system and it's almost ready to be implemented now. So I think from the 1st of August, we will be using the new system. So just some examples of complaint elements, how we pick them up. Why is my child denied similar opportunities to his peers, etc. Social worker ignored parental concerns, for example, lack of contact, minimal progress regarding a plan, and so on. I won't go through all of them, but these are some of the things that we pick up. We've also done quite a bit of work regarding an ombudsman complaint from some years ago. It was from 2018, so a little bit before my time in the post. And we're still working with children's, for example, to ensure that those outcomes are I lost my train of thought, are helping to develop the system, the services, sorry. So the complaints are dealt with in line with the regulations, and this is a particular area of focus for us. As I mentioned last year, we were trying to acknowledge our complaints, which is in line with the regulations, within 2 working days. And I would just like to say that we've seen an increase from in adults from 22% to 84%. You'll see now that we're acknowledging within 2 days, and 77% of children's cases are acknowledged within 2 days. Previously, it was 22% for adults, as I said, and 29% for children. So we're not at 100% yet, but we're striving to get there as much as we can. Again, with quite limited resources, people resources, that is. Whilst the majority of complaints are receipted within 2 days, there's still some circumstances where a receipt cannot be sent, because a receipt, an acknowledgement in terms of the regulations, has to stipulate how we will investigate it and who will investigate the complaint. So it can be difficult to make all those arrangements within 2 days, particularly when there's staff leave and staff meetings and all kinds of things. But we are improving, and I think that is testament to that piece of work we've done. Another issue that we have is that the complaint regulations, the social service complaint regulations, are quite strict and rather severe in terms of the time allowances made for resolving complaints. They're out of kilter, for example, with the NHS complaint system. And we've been working with the All Wales Complaints Group to make these known to Welsh Government, and we understand that a review of the regulations is on the cards, but we don't know how long that will be. So before it is implemented. So at the moment, it's important to know that stage 2s usually take 20 to 25 working days to investigate. And after that, we have to compile the director's letter, and the director has to check the report and sign the letter. That can take up to another 20 days. And we're trying to reduce that all the time. And our director has put allocated diary time in every week to look at reports and so on, or each month rather, to look at reports and complaint outcomes. As mentioned last year, we'll continue to identify areas of improvement to ensure a consistent and customer-focused service. We focus on ensuring complaints are acknowledged and responded to quicker, and that learning from complaints is better embedded in the service. Over the last year, as I said, we worked hard to receipt and acknowledge complaints in a timely manner. However, delays do occur. So what we have done, we have, in working with adults and children's services, we had we have asked them that as soon as they detect anything that looks, tastes, or perhaps smells like a complaint, so please get it to us at the earliest opportunity so that we can record it and that we can deal with it. So I just wanted to say that on some of the improvement stuff, as I said, we've raised with the All Wales Complaints Group conversations with Welsh Government and the Public Service Ombudsman on reviewing those regulations. Some of the actions going forward, part of our action plan leading from this, we're going to be doing, and this has been agreed with the Ombudsman as well, that we'll be doing more complaint handling training and implementing best practice training. The logging of compliments and complaints, we think that some of them could be missed. So again, as I said a little bit earlier, we're taking a lot of action to make sure that we record all kinds of comments, compliments, whatever the case may be. In terms of implement improvements, we keep a log of actions that are agreed with our quality assurance colleagues from both children's and adults, and we meet on a monthly basis. Matters arising from these are debated and sometimes checked with the head of service, for example, or with the director to say, this is what we've detected, this is the type of action we would like to implement to correct the problem. And I've just given a selection of issues that we had on the log. Just for example, we established an internal resolution process with colleagues from commissioning to ensure that the service provider resolves their complaints quicker. We had a bit of a bottleneck in that system, which we managed to overcome. However, we are meeting again next week because it seems a few other problems have crept in as well. So we want to nip those in the bud, as it were. So just to give you a flavor of what is on the log, obviously I can't go into too much detail because it might actually lead to the identification of a complainant or however it may be. Unsure of the role of the independent reviewing officers, for example. So our solution is to investigate the possibilities of IROs attending fostering support groups to establish if it would be helpful or useful to provide an overview of the role and why it's important in the context of fostering. It was agreed with stakeholders and IROs attended the May meeting and now do so on an ongoing basis. And similar, stakeholders agree that a working group should look at designing leaflets about the role of the IRO, as they felt that the leaflet was deemed too confusing and lacked meaningful information. So work is currently underway, and well, that finished on the 1st of July, so we have the outcomes of that, and we're doing some further work on that as well. We detected issues with carers' assessments from complaints as well. And we just educated, obviously through senior managers, the rights of carers and the need for carers' assessments when requested. Quality of life story questions. So what we did, we undertook a project where we took 10 of the last adopted children and assessed the quality of their life story work. Obviously, we didn't do it. I'm not a qualified social worker. So that is done by our QA colleagues. And we'll have the results of that by the end of July, for example. And there's just a few other examples I've left with. Another project we started with was a young person was questioning the information we had available regarding advocacy services, something that we picked up with Slice a little bit earlier. We've done a bit of a project to update all the leaflets and make them available in a variety of formats, including easy read as well. So that's what we're trying to do. Gives us a bit of an overview of what we're doing, and I'll be happy to take any questions if you have any. Thank you, Chair.
Right, members. Councillor Amanda has joined us, but I'm going to chair to the end of this element, and then I'll hand over to Amanda. Do you have any questions at this time for Steve? Yes, Councillor Josie.
I was just thank you very much, Steve, for that.
Thank you, Councillor.
I was just wondering if you could elaborate a little bit. We skimmed over compliments and complaints being missed. Could you just go into reasons why they might be missed? Are they missed when they're being phoned in to Paris themselves, or are they missed during, you know, maybe conversations with a social worker? Could you just elaborate on that little brief statement? Because I find it that it's quite important, but we've just sort of
it is that if we sure, Councillor, sure, not a problem. It's usually we miss them when they don't come through the official complaints channel, which is online or via telephone or via email. Sometimes those complaints are just made to a social worker who's working with a family or an individual, and they sometimes have neglected with their caseload to perhaps tell us. So we go chasing after them. I think that's what we're doing now to make sure that we're capturing as much of the information as we can. Yeah.
Okay.
Does that answer your question?
I think it does. So when we're sending these our social workers out, do they have any quick way of reporting complaints? Do they have any sort of app system or a document that's in a folder somewhere where they can write it just in case it is missed? I mean, what can we try to do to make sure that those little compliments or complaints are documented down, sort of as vital or as small that they may be?
Yeah, there's no particular system, but we could definitely social feedback team email address that we have. So, workers can just drop it in there for us to say that so-and-so has said this, and then we take it from there.
Okay, well, thank you for that. Thanks very much.
Sorry, I'm having a few sound problems at the moment.
Yeah, Steve, could I ask you to stop sharing your screen?
Oh, sorry. Yes, of course.
Sorry, Steve, you dropped out in the last bit of your sentence. What were you saying? That they have an email address?
Yeah, yes, it's a specific email address, social services feedback at powers.gov.uk. Yeah.
Okay, thank you very much, Steve. Thanks.
Any other questions for Steve before? Yes, Councillor Amanda.
Yeah, thank you. Thanks, Councillor Gareth, for chairing so far today as well. Just a quick one, Steve. And apologies if I may have missed this, if it was in the earlier part before I joined. But we've talked before when you brought this complaints last time about tracking of positive feedback where positive learning has been done, and how we then track that it's to ensure that it's replicated across the service. So if, for example, a social worker has done something in a different way and that's really worked well with a family, and how you then consider whether that compliment or feedback is something, well, actually we could look to do that elsewhere, or that could be tweaked slightly. How do you track those kind of things? Because when we went, we've done a couple of groups as well where a few of us have attended your monthly complaints, and that was mentioned that it could be possible to have some kind of tracking system for that too.
We've kept, sorry, Councillor, thank you for your question. We're keeping a log of those as well. I think I changed the order of the annual report this year somewhat. So we started with compliments a little bit earlier. So I did go into that discussion. When we have compliments, we discuss them with team managers, with the individuals, and ask that we can share, and so that this is replicated across services. So we deal with it in OMT, operational management team, as well as team meetings as well.
Great, thank you.
Thank you.
Steve, can I ask you a couple of questions?
Yes, Councillor.
In respect to complaints, in your report you mentioned some are related to communications. What sort of percentage relate to poor communications between officers and the clients?
I would, it would be guesswork. I don't have that percentage at this current moment, but it depends. Is probably the best answer I can give. Is that in adults it's not really a problem. In children's it tends to be a bit of a problem. But I'm not saying it's the problem of practitioners. It's probably it could be the understanding of the client, not understanding the processes very well.
Right. That leads me on to my next point is perhaps for future reports, we could have a breakdown of the elements. So you've listed a number of elements. Perhaps
Yes.
we could have a breakdown of how many times that element has occurred in a complaint. If that's an option.
I think we'll be able to do that, particularly with the new system that we've got coming in on the 1st of August, Councillor, which I mentioned, our complaints recording system. Yeah.
And I think it would also be good to see the complaints and the compliments split across between the areas of which areas of each service they relate to.
Yes. Okay.
Just to see if we can see if there's any trend there.
Yeah, sure. Okay.
Councillor Edwin, I think you had your hand up.
Yeah, thank you, Chair. Just a quick one. Would you be involved where there is an issue where there is an unmarried couple and there is problems with the man having access to the children? Would the complaints be addressed to you then on that?
We do have complaints regarding access to, what contact time with children and so on. Yes, we handle them from time to time. Yes.
Right. Okay.
Yeah.
Because there's one particular one which I'm aware of, whereas
sorry, just to interject, Councillor Edwin, just to remember, we're in a sorry, Gareth, as well, for I know you're chairing this, but we're in a public setting, Edwin. So if this is going to relate to a particular individual case, I would rather that you raise that with behind the scenes due to confidentiality issues, if that's okay.
Yeah, it wasn't really going in specific angel, but I'm quite happy with the answer I've had actually, so I'd leave it there.
If you've got a question to do with how a complaint is handled generally, then I'm happy for you to carry on. But I don't want. This isn't the forum for specifics.
No, I appreciate that. Okay. No, I'll leave it there. Thank you.
Sorry, Gareth.
No, it's fine. Steve, can we go on to the recommendations we made to Cabinet last time? Are you happy that you've met all those or provided feedback on all those?
I think so. I think on the main ones, yes, that I was aware of, yes.
Right. Okay. And perhaps I need to check then. I'm not sure. I've had all the information that we suggested should be sent to the committees, but I'll check that back, come back to you.
Okay.
The one thing I would like to see in your report is, and if you look at the next report we've got coming from the director's annual report, it's clearly laid out there. These are the targets we set for the year, for each area. This is what we did in the year, and then these are the targets for next year. For example, I'd like to see some KPIs within it around each one. Complaints saying we were going to reduce the number of complaints from X to Y, and just give some feedback. And it may well be that you said you think there's lack of complaints being made, and I know it's a very, very difficult one to evidence, but just some sort of information of what your key performance indicators were and what how you met them.
Sure. Thank you, Chair. Yeah, sure.
Is there any more questions from members? Yes, Councillor Ben.
Yeah, thank you for the report. You said that the new complaint system is going live on the 1st of August. How does it differ from the current one?
Currently, we use the GOS system, but it's not giving us the statistics that we'd really like, and it's quite cumbersome to use. It's a little bit clunky now. It's quite an old system. So we've developed one in-house with our own IT system, with our own IT team, rather. And it's got close support from the IT team. So we think it's just going to be better in terms of statistics and giving a lot of the information that is requested, for example, for the annual report and so on.
Thank you.
Is that okay, Councillor? Thank you.
Thank you. I've got one final question. And at the end of the report, you say when a complaint's being resolved, it takes up to 4 weeks for the letter to be sent to the complainant. Can you explain the processes that you go through in that 4 weeks? Because to me, that seems a long time.
It is a long time, and we are. That is probably one of our KPIs with respect, Councillor, you know, to bring that down. It's basically. Sorry, can you just give me the question again? Sorry.
Yeah, just
Yeah.
talk me through the process followed that results in a 4-week.
Oh, right. Yes. So
for the report, for the letter.
So we're talking about stage 2 complaints there. And so that's done by an independent investigating officer. So they will compile their report. The report gets sent back to us. We scrutinize the report and we discuss it with senior managers, perhaps the head of service, to see that it has dealt with what we wanted it to be, you know, deal with. And then we produce an accompanying letter for the director to go with the report back to the complainant. And that can take some time back and forth as we get the letter right. So it can take up to 20 days.
Okay,
Yeah.
thank you.
Thank you.
And does that letter have to go out from the Director
Yes.
of Social Services, or can it be from the, yeah, okay.
No, it's a statutory requirement.
I can see Nina nodding.
It's a statutory requirement. Yes, Councillor.
Thank you.
Yep.
Yes, Councillor Josie.
Thanks, Gareth. I had that point as well. So just to move on from that, when we are sending out a receipt of notification of the complaint specifically, with that 4-week window, are we then sending back a document with that process so they are aware of what's happening in that 4 weeks?
Yes, under the regulations, we have to update them. And we tend to do our updating every fortnight, you know, if it's a long process, to say, this is where we are in the system. And you can expect your letter by no later than, with the report by no later than. Yeah, so.
And that's specifically drawn out, like you said, that we're using somebody independently, that it's going to the offices. Is that clear on these letters?
Yes, yeah. For all adult cases, for example, I oversee the case. So I'm responsible for communicating with adult complainants. On children's, we use a panel of senior managers, so they will update the complainants as well and tell them where they are in the stage of the complaint. Yeah.
Okay, thank you very much, Steve. Thanks.
Thank you, Councillor.
Any other questions, members? If not, Steve, can I thank you for your presentation today?
Thank you, Chair.
And answering the questions, and I'll hand over to Councillor Amanda to chair the rest of the meeting.
Okay, I can leave now, Chair. Thank you.
Thank you.
Yeah.
Yeah, thank you.
Thanks,
Over to you,
Gareth.
Amanda.
Thanks, Gareth. Thanks, Steve. And apologies all for being delayed this morning. Next on the agenda, we have the Director's Annual Report. Nina, I think, I presume you'll be leading on this, will you, Nina? Or will portfolio holders be introducing it as well?
No, I'll be leading as it's my report, but
Okay,
thank you, Chair.
Just before we start, Nina, just to say to councillors, this is for us to note rather than scrutinise. It's something that has to be done every year. As we've done in previous years, if it's okay with you, Nina, please, can we keep it fairly short and sweet to headlines? In particular, what you think has gone, and I know this is quite comprehensive in the report, and all councillors will have read it, but if you could give us the key headlines on what you think has gone really well over the last year and where you think the challenges are and the opportunities for the next year, that would be great. And then councillors, when we come on to questioning, again, what I don't want is for you to be asking sort of really deep scrutiny type questions on this, because it's such a wide overview. What I'd like you to think about, please, if there's anything in this report where you would like more information on in the future, or if there's something in here that's happening within the next year, in terms of the sections where you know what you plan to do in 23-24, councillors, if you think there's something in there where you'd like that to come to scrutiny over the next year, or you'd like information, I think that would, what I'd like you to do is raise that at the end, rather than doing sort of in deep questions, because we've still got quite a lot of agenda items to get through today. And on that note, I'll hand over to you, please, Nina. Thank you.
Thank you, Chair. Just as a way of an introduction, because I'm aware we've got
perhaps some different committee members than previous years. Directors of social services are required to undertake an annual report under the requirements of the Social Services and Wellbeing Act. The report does follow a set template, okay? And the intention is that the report must be published as soon as practicable after the end of the year to which it relates as well. So there's a real onus on us to get this completed as soon as possible. As a director, I have a role to present this document to the council. That's one of the requirements. It's also copied to Welsh ministers and will be made available on the local authority's website as well. The draft version in front of you today contains the basic text. Once the text is finalised, it will be translated and there will be going through graphic design, etc. So I just wanted to make that clear at this stage. The report must be written in a way that can be read and understood by a range of audiences. So that includes service users, carers, the general public, elected members, partners, regulators, and the Welsh Government. So a real wide audience for the report, which is a challenge when you're writing it as well. The report should not be overly long and needs to be written in clear, plain English. The 20-page guidance document suggests the report should be no more than 25 pages. You will note ours is more than that, I'm afraid, but we have tried to keep it as succinct as possible. Such a report cannot cover the breadth of all of the work that we're doing in social services, and I'm sure you appreciate that as well. We've tried to include links to other documents and information where we feel that that can add value. The report is not a performance report, so we're not looking in detail at KPIs, etc. The guidance specifically states that recital of data is unhelpful. And also, I think, it's important to remember this report is not a standalone exercise. It's a brief summary and overview. As you know, we have other processes that sit alongside it. So monthly performance data analysis, quarterly performance monitoring, annual self-assessment, etc. So, it needs to sit in the kind of suite of all of that kind of assurance and work that we do. The committee may be interested to note that Welsh Government currently have a live consultation linked to the Rebalancing Care and Support Programme. The consultation closes on the 14th of August and includes proposed changes to the Code of Practice on the role of the Directors of Social Service, and it includes new guidance on the annual report. So this could be the last year, and I expect it to be the last year that we see a report under this template and etc. Things will probably be looking to change moving forward. So that, as Chair said, the draft report is in front of you to full committee today for information. It's scheduled to go to full council on the 20th of July. So just to give you that information, and I would be really grateful for your comments. Chair, I hadn't prepared a detailed kind of walkthrough of the report because I thought with the agenda we've got today, I felt that it was more important to go to yourselves to ask for your comments and questions on the document, etc. But you've asked if I'll briefly kind of outline some of the key challenges and key achievements. So I'll briefly do that for you. But I've also got the heads of service here as well. So Sharon Powell's here and Rachel Evans. So, if they felt that they wanted to highlight perhaps their top 3 challenges, achievements, etc. as well, up to you, Chair, whether you would like to wish to do so. And also, I'd like to just, apologies, I should have mentioned this first, Chair, but we've also got Sharon Fruin here this afternoon. This morning, apologies, and she's our new head of adult social care. Sharon only started on Monday of this week, but we're really glad to welcome her to the Powys team. But I don't think we can expect her to answer any questions today, but she's here to meet you all and to follow the report as well.
That's great. Thanks. Welcome, Sharon.
Thank you. Okay, in terms of challenges, I think as a committee, I think you're all very well aware of the challenges that we've got across social services. I hope that we meet with you regularly so nothing's new, nothing should be new in this report. Recruitment and retention challenges across the workforce is something that we continue to have problems with and issues with the use of agency staff, etc. But we have also, it's one of our key achievements of the year as well, because we have seen improvements made. We've been working with corporate colleagues on improving we've been having recruitment kind of days and events. We've got now a much easier, simpler, quick apply process that's been developed as well. So, you know, it's one of the key achievements, I think, of the year as well, which is really good news. But there's a lot more to do, and it will be a priority moving forward. In terms of adult social care, there has been challenges in meeting statutory duties, with assessments, with reviews, with waits for packages of care, etc. There's been an increase in legal and court challenges and work for the officers and for the teams as well. So that's something we've had to balance within the year. There's been some backlogs in delays in provision of equipment and ongoing unpredictability in the provider market as well, with work ongoing with Rachel's team to support as well. In terms of children's services, both children's and adults, really some positive work to engage and shape our services in line with people. The children's have got a new participation officer, with work outlined on page 4 of the report in terms of the work that they've been doing. But, you know, a Mind of My Own app, co-producing policies and documents with these young experts, supporting care experienced children and young people to meet with ministers. The young people were part of the interview panels for the head of service role as well. The Powys Junior Safeguarding Board has produced an excellent videos on the do's and don'ts of caring, etc., and the Junior Start Well Board as well. So there's lots of work happening there to engage with children's, and the Bright Spot survey as well, of course, which has really given us lots of valuable and rich data and information. We also do, you know, staff surveys regularly, and Lynette and I do regular meetings and roadshows with staff as well. We've got another next series starting next week. In adults, there's been work with Kaleidoscope, Cyfle Cymru, artists and residents, learning used from that to design services, etc. as well. Powys Older People's Forum has now been expanded and is really an age-friendly action plan is being developed, and Councillor Sian Cox is leading on that work as well. Work has begun on a citizens' charter for the Physical Disability and Learning Disability Forum, and people from both of these forums and all forums have been involved in shaping and designing services as well, which I think is really important. And as the committee's just heard, you know, from Steve and the previous report, we use feedback and learning from complaints, from compliments and from issues raised through that process. And there's been a real strengthening of that area as well in the previous 12 months. Work, obviously, Oldford site in Welshpool has been opened in October of last year with the Integrated Family Centre, which has been lovely to see. And I know many of you will have been there to kind of see the good work that is happening with partners as well there. And work on our closer to home as well, with opening up, and just to confirm to the committee that we had a confirmation from CIW last week that Henry Gunnice has been registered, so it's great news. But perhaps if I pause there, Councillor Amanda, because obviously if I go into too much detail, we could take up the rest of your committee meeting, but happy to take any comments and questions, or perhaps to move to heads of service for their comments as well. Thank you.
Yeah, thank you, Nina. And as I said, I don't want to spend too much time on this, but yeah, just quickly, if the heads of services have got anything to add, Sharon, Rachel, or Sharon, if you wanted to add anything, to say where you really hope to see focus on either improvement or new opportunities in the next year, that would be good to hear quickly.
I'm happy to come in there if that's okay.
Hi, Rachel. Yeah.
Morning, everyone. I think Nina's summarised really well, and really has given a good overview in terms of some of the challenges, but also some of the huge successes that we've had across the sector, which you know, I'm really particularly proud of. I think one of the key things that stands out for me in terms of challenges, certainly from a commissioning perspective, is around the unpredictability of the provider market, and still recognizing some of the challenges that we're still experiencing in terms of some of the workforce challenges, and the impact in terms of capacity. However, just to give some assurance to committee that we are working really strongly with our partners, particularly Parasite and Health Board and the provider sector, to really understand those challenges, so to be in a really strong position to be able to remedy and put in place some really good solutions. We have got what's called a modernising domiciliary care programme of work, which looks at increasing capacity around domiciliary care provision, as well as direct payments. And we very much used the provider feedback really to craft some of the actions in order to make sure that we're putting the right interventions in place. It's very much in its infancy, but we are starting to see some nuggets of change happening even at an early stage. So I'm very optimistic that we can really have a strong impact. So I'll be really keen to be able to feed back on that as we progress. Thank you.
Great, thank you, Rachel. And Sharon?
Yeah, good morning, everybody. Bore Pawb. Yeah, just to kind of summarise a little bit more in respect to children's services, we had a year of two halves. In the sense that there were lots of challenges in the first half of the year, which you'll be acutely aware of, around budget pressures, staffing, recruitment and retention pressures, and placements for children.
Oh, we seem to have lost Sharon. Is that just me or?
No, it's general.
No,
The
Sharon.
second half of the year.
Sorry, Sharon. We you froze. So can you just go back, rewind about 15 seconds?
Okay, so the top challenges were budget pressures, staffing, recruitment and retention challenges, and placements for children. So I'm pleased and would like to assure you really that the second half of the year, we managed to reduce that incredible deficit that we had halfway through the year to a much more reasonable deficit. The plan is to continue to work on that budgetary pressure to ensure that we are within that budget. In terms of recruitment and retention, we did have 2 managed social work teams that cost us a lot of money to bring him in at the time when it was difficult and challenging to retain staff. We were able to reduce those, and by the end of the year not have 2 managed teams. And through all the really positive great work that we're doing with our Grow Our Own project, we've actually got 10 newly qualified social workers qualifying now over the summer months. So our aim is to continue on that trajectory of building our own workforce from within. And in terms of placements, that is a national shortage of placements, which absolutely still continues right now. But what we've done in the interim is kind of look at developing our own residential provision, look at strengthening our 16+ provision, and just looking about how we're doing things differently in terms of intervention and prevention. All those things are in our improved business plan for this year, and the key priority for us is really strengthening our closer to home strategy, with lots of that information kind of falls underneath.
Thank you, Sharon. So councillors, I just thought I'd ask you if there's anything in this report where you would like to receive more information in the future. If you want to just have a think about that now. Just a couple of things that I would just like to say that I'd like to see in the future is there's reference in here to work going on with in conjunction with health to do with therapeutic attachment teams and providing support where the CAMHS thresholds haven't kicked in. I would really like to be involved in that at an early stage from a scrutiny perspective. And the health board are due to come to us in the autumn, I think. I'm not sure whether we finalised the date for that, but if there's some kind of update that could come then about that, that would be fantastic. I've had concerns for quite a long time that the CAMHS thresholds are very high. They don't kick in until crisis points. So anything that we're doing before crisis point to support young people would be great to hear about and how you're planning that. The other one is the pre-birth support work that you're starting to do to bring us in line with other regions. Again, I'd be interested to hear, I didn't know we weren't in line with other regions, so I'd like to hear what we're doing there and how that's going to be worked in with our early help and intervention teams and how you envisage that's going to look. And then the final one again, sorry, Sharon, Sharon P. These are all children's ones. The other one is unaccompanied asylum-seeking children. Obviously, that's something that's increased over the last year or so. And I'm aware from discussions from sort of senior officers that a lot of these children are being placed out of county due to their needs and where is best placed for them. So I'm keen to hear more about that and how we are planning on managing the support that we provide those children in a sustainable way, so that, well, that they get the support that they need, given that some of these children are placed in Liverpool or London, and yet their social workers are here in Paris. How that support then is what they need and deserve, but then also the impact that has on the actual social workers as well, how that's done sustainably. And I think that's something that we would need some more information on in order to look at. So those are 3 areas. You don't need to comment back on those. And I can see that Councillor Gareth has got his hand up.
Yeah, just very quickly, Chair. Sharon's mentioned the one area I thought of, which is around the Children's Services budget, and obviously we'll pick that up as part of our normal monitoring. The other linked area then is there's a comment around sickness levels within Nina's report, and perhaps we need to have a look at that to see what the causes are and what actions the authority can take to actually support those sickness levels to be reduced in any way, and what support we need to do to give to the staff.
Yeah, thank you, Gareth. Perhaps when we look at the quarterly performance, we could look at sickness levels. I think that would be a good place to bring that in, if you're able to bring any themes to that. Any other councillors got any questions? I can't see any. Nina, did you want to just say anything back on those points that we've just quickly said?
Yeah, no problem at all. No, I've made a note of the kind of issues, and Councillor Gareth, as you said, the budget, you know, you will be heavily involved in that as we move forward the latter half of the year, as is normal process. I agree with the sickness. I think as you say, Chair, Q1 would be a really good chance. Perhaps we have a bit more of in-depth discussion about what has happened, because we have seen an improvement. So it'd be good to kind of outline with you what we've done and what we've seen and what the trends have been, etc., and look at that in a bit more detail. So yeah, and then the unaccompanied asylum seekers, absolutely, pre-birth support and therapeutic CAMS thresholds, etc. We'll take those away, and we'll work with the team to kind of program them and put them onto the future forward work program Scrutiny and bring those forward. But you know, thank you for those, and yeah, happy to do so.
Councillor Sandra, I can see you've got your hand up. Hi.
Hello, good morning, everybody. Just picking up really on what Sharon really has said. It has been a year of 2 halves. When Councillor Sue at that time started this, it was an eye-watering amount within the budget that we had to face. And I just want to commend the staff in the work that they've done over a period of time, and they have, you know, tried their best to turn things around. I agree and welcome this opportunity to look at any possibilities to try and improve their service. It's essential that we do it correctly. So everybody is a corporate parent. We all take a part in this, and I just want to thank the committee for their contribution to this. I've made a note of the 3 points that you mentioned, and I will be discussing with our meetings to see how we can improve that. So diolch yn fawr.
Diolch, Councillor Sandra. So that concludes that item agenda. Thank you very much, Nina. So the next one is item number 7, which is the closer to home residential homes and 16+ accommodation presentation. And
Chair.
Oh, sorry. Yep.
Sorry, Chair. We need to vary the agenda. You've missed this bit this morning. I just emailed you. I've been notified by the services that both the closer to home and extra care strategy contain confidential items.
Okay.
So we'll need to pass a resolution to move into confidential session.
Sorry, I thought it was just the extra care one that contains.
No, that's changed a lot as well.
Okay.
So just the work program first, please, if we can, and then we can pass a resolution, then move to the 2 presentations.
Yeah, the work program I don't really want to spend too much time on WIN because I think that we need to look at that in reflective session.
Yes.
So can I, am I allowed to bypass that item and move that into private as well, just because we've got quite a few things to jiggle about in there. So I'm going to propose we do that too. And on that note, then what we need, if I could just have from both Sharon and Rachel, please, just for the public's awareness, the reason why these need to go into private session, please. Sharon, I'll come to you first.
Well, thank you, Chair. And the reasons why our presentation needs to go into the private arena is that there's information contained in it, not necessarily with individual children's names, but with individual care plans and.
Oh, we've lost you again. Sorry, Sharon. Hello. Hello.
I think the reason was, Chair, as Sharon was saying, it's individual care plan, but actually not. It's the costings, and because there's so limited number of individuals involved, there's a potential for identifying individuals arising from that.
Okay, thank you. And Rachel, for yours?
Yes, mine is in relation to commercial sensitivity. So in order to go through the detail around the schemes and the development and to provide a really good update, it will be, it will be going into some of that commercial discussion. So it was felt best that that needs to be undertaken in private session because of that.
Okay, thank you. Okay, well, I will move to suggest that we go into a private session then, please. And can I have someone to propose that?
So the resolution, Chair, be resolved to exclude the public for the following items of business on the grounds that we disclosure to them of exempt information under category 3 of the local authorities access to information variation Wales Order 2007.
Thank you. And I need a proposer.
Councillor Benjamin's got his hand up.
Yep.
And Councillor Josie.
Yeah, happy to propose.
Yep. Josie, are you happy to second?
Yes, I'm happy to second, Chair.
Thank you. If anyone is against this, can you please raise your hand now? No. Okay. Well, I move that we go into private session then.
Bear with us, Chair. We'll ask the public to leave.